Hi everyone, Happy New Year and welcome to 2021 Excela Health Virtual Mall Walkers. We're so glad that you're joining us today as we kick off a brand new year. Not only is it a new year, but this year, 2021, marks the 10th anniversary of our Excela Health Mall Walkers program, which is really exciting. To celebrate, we want to introduce to you a new activity we will be featuring each month in one of our virtual videos. We will be taking you on a health journey to popular destinations throughout the United States, figuratively speaking, of course. Along the way, we will be tracking the number of miles and steps it takes to walk from the starting landmark to the ending landmark, as a way to achieve the daily step count recommended by the American Heart Association. Your participation in our activity is totally voluntary, and we recommend that you talk to your physician before beginning any type of physical activity. Our walking journey will also complement our featured healthy recipes. Before we dive into the first leg of our journey, let's check in with Dawn DeVoli for a brand new segment of What's in Your Pantry.
Hi everyone, and welcome back to another season of What's in Your Pantry. In today's episode, we are going to be visiting the city of brotherly love and cooking up a food favorite from that area. The food happens to be the Philly cheesesteak. My recipe in today's show happens to put a healthy twist on the Philly cheesesteak. We're going to be making it lower in carbs, lower in fat, and lower in sodium. So the name of the recipe that we're going to be cooking up today is called Philly cheesesteak skillet. This is a super easy meal. It is done in one skillet, and it is chock full of immunity supporting nutrients. Like I said, it's lower in fat than the original recipe and lower in sodium, also lower in calories. So let's get started and review the ingredients. So the ingredients for our Philly cheesesteak skillet meal happen to be avocado oil, flank steak, sliced green pepper, red pepper, onion, and mushrooms, minced garlic, salt and pepper, liquid aminos, apple cider vinegar, pecorino romano cheese, and shredded mozzarella cheese. So let's get started and create this super easy meal. So the first step that you're going to do in our one skillet meal is you're going to slice up your flank steak. Now, a little kitchen tip here with slicing up steak is it's easier to do if the meat is a little bit frozen. So you might want to try that. Slice up your meat. We're going to season it with salt and pepper, and then we just add it to the skillet and saute it in our avocado oil. Now, we use avocado oil because of its healthy fats, and it has a higher smoking point. And this is what your meat will look like when it is completed. Okay, so in the original Philly cheesesteak sandwich, they use ribeye steak. Now, when you swap out that and use flank steak, or if you can't find flank steak, you could use a skirt steak, you're going to be saving about 350 calories and some fat, about 14 grams of saturated fat. All right, so make that healthy switch. Next step, you're going to take your vegetables, all your colorful vegetables, you're going to add them to the skillet. You're going to add the liquid aminos, okay? Now, the liquid aminos are a soy sauce alternative. If you don't have them, you can use low sodium soy sauce or Worcestershire sauce, okay? So we're gonna add that along with our apple cider vinegar. We're gonna cook these colorful vegetables that are so full of immunity supporting nutrients in our skillet till they are tender crisp, okay? Then once those are cooked, we are gonna add the meat back to the skillet. We're gonna keep the heat on and stir it up And to this, we are going to add our cheeses, okay? So if you're familiar with the original Philly cheesesteak, it uses an orange pasteurized processed cheese food. Some people call it Cheese Whiz. Here what we're doing, we're making a healthier version, much lower in sodium, over 800 milligrams lower in sodium, by using Romano Pecorino cheese. Let's use all of that. And shredded mozzarella. Okay, shredded mozzarella is naturally lower in fat. So you're gonna cook that up till just the cheese melts, all right? So as you can see that this is so super easy. Everything is done in one skillet. Now, after your cheese is melted, it's ready to serve. I will probably serve this with a whole grain, maybe like a whole grain rice, a brown rice as a side dish. Or if you wanted to eat it the traditional way as a sandwich, I would encourage you to use a whole grain roll, all right? So there we have our super easy skillet meal. It is quick, it is satisfying, and it is low in carbs. So our healthy habit tip of the day for this episode is do not be afraid to add immunity supporting vegetables to your meals. Just because the recipe doesn't call for it doesn't mean that you can't add them, right? Just like we did in our recipe here today. So there you have it. Please give this a try. It is a super easy meal full of nutrients, full of fiber, and it's low in carbohydrate. So as always, thank you for joining me. I hope you will stay tuned. And until then, stay healthy. We'll see you later. Bye-bye.
Welcome back, Mall Walkers. We hope you enjoyed our cooking demonstration and our healthy habits tip of the day. In this week's email blast, you should have received additional healthy recipes, plus links and content that promote positive mental, emotional, spiritual, and physical health and well-being, including our exercise challenge, which will be our walking journey each month. So, are you ready? Let's get walking. Today we're going to be starting in Philadelphia, the great city of brotherly love and home of the original Philly cheesesteak. We're going to start our virtual walk here at the Liberty Bell by doing some warm-up stretching. Then we're going to enjoy a leisurely stroll over to the steps of the Philadelphia Museum of Art. Finally, we will do some cool-down stretching at Independence Hall. Total miles for today's walk amount to 4.6, which translate to 9,200 steps, which is just under the recommended daily step count goal endorsed by the American Heart Association. Remember, if you can't achieve the daily step count goal, that's okay. The important reminder is to keep moving and keep active, even if it's for only 5 minutes or 5 steps a day. Before we wrap up today, we have a featured physician presentation for you, since it's Mall Walkers Day. Dr. Michael's work from the Excela Advanced Lung Center shares with us the importance of scheduling and maintaining our preventative health screenings, including a CT lung screening. Stay tuned for his presentation. Until next time, stay safe and stay healthy. We'll see you soon, Mall Walkers.
In Touch is a public affairs presentation of Broadcast Communications, Inc.
I'm Eric O'Brien, keeping you in touch with the community. Today on In Touch, I turn things over to my colleague Barry Banker, who has today's interview.
Our guest today is Dr. Michael's work, the medical director of thoracic surgery, the medical director of robotics, and the director of the Advanced Lung Center for Excela Health. Doctor, thank you for being with us today.
Barry, it's my pleasure. Thank you for having me.
Well, I think we have a lot to talk about, and first of all, I guess I need some of the things in your specialties defined for me. What is thoracic surgery?
thoracic surgery is surgical procedures done in the chest cavity. So, in the chest, you have the heart, you have lungs and esophagus and the pleural surface. So anything that involves surgery in that area is the purview of thoracic surgery. And we're broken into two different disciplines. There's cardiac surgeons who predominantly do surgery on the heart and the blood vessels around the heart, and then non-cardiac thoracic surgeons, and that's what I am, who do surgery on everything else in the chest cavity. So much of what we deal with is lung cancer, esophageal cancer, problems with the ribs, fluid in the chest cavity, those kind of things.
And I see you also deal a lot with robotics, which is sort of a new field, is it not?
It is. One of the things that we have done globally in surgery is everyone's afraid of surgery. Everyone's afraid of pain, of big incisions, recovery times. And so over the past 30 years, there's been different concepts in trying to reduce invasive surgery, but still do as good as open traditional surgery. And the robotic platform is probably the latest platform in our field. It's been around for the last decade or so, and now has become increasingly really popular. I've been doing it for about 10 years. I was one of the early adopters, and I've done over 1,200 cases using robotic technology to reduce the invasiveness of traditional surgery at Excela.
And then the Advanced Lung Center, I guess that's a little bit more self-explanatory, but can you tell me what that part of your job is?
Sure. One of the things that we know is that thoracic surgeons deal with a lot of cancer, and we deal with lung cancer. Lung cancer is the most common diagnosis of cancer worldwide, in about 240,000 patients. And so 160,000 or so die each year from lung cancer. And in Western Pennsylvania, lung cancer is a concern. The incidence is extremely high. It's a lot higher here than it is in Denver, Colorado, for instance. And so the Advanced Lung Center is an initiative at Excela to really address lung cancer screening, a way to be able to identify people at risk for developing lung cancer, identify cancer early, and treat it early in its earliest forms. Because if you treat it early, the ability to cure goes way up.
That's true with most forms of cancer, is it not?
It is. For breast cancer, for colon cancer, cervical cancer, prostate cancer, early detection is the key. And one of the things that we know as we live through COVID-19 pandemic is that when this rolled out in the United States in March of 2020, we centralized healthcare resources to deal with the pandemic and to reduce the risk of spreading. And one of the things that suffered nationally and globally was screening. Mammograms for breast cancer were down. CAT scans for lung cancer detection were down. Colonoscopies were down. And prostate exams. So an important point here is that now in 2021, we have to get back into the screening algorithms that we had pre-COVID, as hopefully we get through this terrible pandemic now that vaccines will become more widely available, and hopefully with mitigation, reduction of exposure, and the numbers start to fall, we'll be able to get back to full service. We're doing all the screening right now at Excela, and we really want your listeners to understand the importance of contacting their primary care doctor and following up with screening, especially in breast, lung, and colon.
The insurance companies actually are promoting these types of screenings now more than they used to, are they not?
Absolutely. Every society, is the American Cancer Society, it talks about the importance of screening across populations, because it's the only way we can make a difference. For instance, if we look at the cancer mortality rates in the United States since 1991 to 2017, interestingly, we've had a decline of almost 30% in the chance of dying from lung cancer over that time period. Even from 2016 to 2017, the risk of dying from lung cancer in the United States dropped 5% in men and 4% in women. And so why is that? Well, it's several things. One is screening. It's sending people to look for things before they know they have them, finding them at their earliest stage. We've also gotten much better at imaging, CAT scans, MRIs, and other diagnostic testing. And then adjuvant treatment. If you do develop cancer, the weapons that we have are far more sophisticated, advanced, and numerous than they were even a decade ago. So, but ultimately, the earlier you find something, the more you have the ability to cure. Very important message.
You mentioned one statistic that kind of surprised and to some extent alarmed me, and that is that we have more incidents of lung cancer in this area than we do in other areas of the United States. Did I hear that correctly?
Sure. You did. Certain states in the United States have a higher incidence. Kentucky, West Virginia have higher incidences than some of the western states. And so what are the risk factors that we're dealing with? We're dealing with elderly patient population, a lot of whom have smoked, and a lot of whom have had occupational exposures to hazardous chemicals, coal mines, and those kind of things. So if you say, what is the most important risk factor for lung cancer? It's tobacco consumption, a history of tobacco use. And then occupational exposure and other exposures, radon gas in the house, asbestos exposure to dyes and other caustic agents, beryllium and things. So Western Pennsylvania has a lot of that, had a lot of that industry, and has a lot of smokers, unfortunately. It has an elderly population. So those factors together lead to a higher incidence of lung cancer.
What exactly is lung cancer and what causes it?
Lung cancer is, any cancer is an abnormal growth of tissue that shouldn't be there. Now, all parts of the body can develop cancer, whether it's breast, colon, in stomach, skin. And so what happens is normal cells change and they become unregulated and they start to grow. And in the lung, that's lung tissue, and it starts to grow. And the problem with cancer is that it gets such unregulated growth that the cells can spread throughout the body, and they go to places that can really be harmful. They can spread to the liver, to bones, to the brain. And that's the real challenge of cancer, is early detection before any of that happens. The biggest risk factors for lung cancer in the United States, again, are tobacco consumption. 85% of people with lung cancer have had a prior history of tobacco use, smoking use. And the second higher risk, especially in this area, is radon. Radon gas in the basement is a concern. 20,000 cases of lung cancer in the United States are attributable to odorless, hard to detect radon gas. And that's why we encourage people that have basements to have their radon levels checked to make sure they're at safe levels.
What are the treatments that are currently available for lung cancer?
In its earliest stage, there are 4 stages of lung cancer. There's 4 stages of every cancer. They're grouped by stage. Stage 1 is when you have a relatively small tumor in one part of the lung that hasn't spread. And in those patients, surgical resection is still the mainstay of treatment. And what's really interesting is in the early 2000s, we would look at outcome data in lung cancer surgery and say, well, how did patients do? And we were actually pretty proud of our outcomes. If they had surgery on a Monday in a hospital, they might go home Saturday or Sunday. They'd say 5 to 6 days, and that was considered good. In 2020 at Excela, if you look at the length of stay after lung cancer surgery, in many cases it's less than 2 days. And a lot of people go home overnight. And it's been somewhat of a revolution of how we do it. We do it with a lot of minimally invasive techniques. Our group is a proponent of robotic surgery. We did over 600 thoracic cases last year and did approaching 200 robotic lung surgeries. So This allows people to really recover quicker with less pain. They can get home, they can resume their regular activity, including driving, in short order. If the tumor becomes more advanced, then we look at combination treatment. Chemotherapy is the mainstay, radiation treatments. And then we have new concepts in immune therapy, where we actually use the patient's own immune system to attack the tumor through very, very complex pathways. Sometimes this requires just a single infusion of medication. In other times, we can actually use pills to block tumor growth. So cancer care has gotten much more complicated, much more elaborate, but also much more hopeful in keeping people alive, keeping their functional capacity.
So you usually have a good outcome.
In lung cancer, unfortunately, patients present late. So if you're diagnosed with lung cancer in the United States this year, the probability of being alive 5 years from now, cancer-free, is roughly 19 to 20%. So 80% will die. The ones that do the best, Barry, are the ones that we find early. And that really speaks to the importance of screening. And so the people that are eligible for screening of lung cancer are people between the ages of 55 and 77 who are former smokers or current smokers and have smoked the equivalent of a pack of cigarettes a day for 30 years. We want to see those people in our system, and we put them through a CAT scanner to try to detect cancer before they have any symptoms. Those are the people that do extremely well. And we at Excela now have done over 9,000 screening CAT scans for lung cancer screening since 2016. We screen about 200 to 300 people a month. We screen at multiple sites, and it's a great program. It's a program that really has led to the detection of cancer early in many patients and given them the chance for cure.
So the CAT scan is the main screening feature that you use?
In lung cancer, CAT scan screening is the mainstay of screening. And what is a CAT scanner? A CAT scan is basically a complex 360-degree X-ray. And, it probably takes 5 minutes on the scanner to do the whole scan, and maybe actually even faster on some scanners than that. And what we try to do is get the scan, and we inform the patients within the next day, what their findings were. We don't make them sit for a couple of weeks of worry. We call them right away and give them peace of mind, and also communicate with their primary care docs.
Now, we've talked a lot about cancer, but what other procedures are done in thoracic surgery?
The other big piece of work that thoracic surgeons do often deals with reflux disease, hiatal hernias. A lot of people have stomach hernias. They've been told, I have a hiatal hernia, or they have bad reflux. And in the United States and worldwide, the treatment of reflux often is medication, which works quite well. Some people don't want to be on medication long term, and there's various options to treat reflux and to address hiatal hernias at every age. We operate on people in their late 80s who have very big stomach hernias and who are troubled by either reflux or the long-term outcome or complications of reflux, scarring of the esophagus, difficulty swallowing, shortness of breath. And so using a lot of minimally invasive technology, we have a pretty complex program, and we'd love to see that kind of person who's really been struggling and says, I want to look at an option. And I tell people, don't fear surgery. Surgery may be the best option to get you back to quality of life at any age. We do a very comprehensive evaluation, and in the right person, we have very durable procedures.
Are reflux and GERD the same thing?
That is correct. GERD, G-E-R-D, stands for gastroesophageal reflux disease, and that's exactly the same thing.
Now, many times that will lead to esophageal cancer, will it not? Or can it?
That's an excellent point. And Barry, what has happened in the United States in the 30 years ago, esophageal cancer was often caused by high levels of tobacco use and high levels of alcohol use. in today's world, over the past decade and a half, esophageal cancer has changed. It now is occurring in younger individuals, principally men that are a little bit overweight, and men that have had reflux. You're absolutely correct. And that's really changed. About 19,000 people get esophageal cancer a year. It's an extremely aggressive cancer. We have a lot of minimally invasive options even for those patients. They often need comprehensive care for treatment, but reflux is a risk factor. And that is the person that should be seen by a gastroenterologist, have a thorough evaluation, appropriate testing, screening endoscopies in the right patient profile, and good follow-up. Absolutely correct.
In that same kind of pigeonhole, there's, I believe, a hyperhidrosis. What is that?
Well, hyperhidrosis is another condition that thoracic surgeons do. It's not related to reflux, but what it is uncontrolled perspiration in different parts of the body. And so the classic patient is actually fairly young, 20 years old or even younger, and their hands sweat so bad they can't really do their activities of normal living. They have trouble holding a steering wheel. They have trouble in school because they have excessive perspiration of their hands, their feet, or their armpits. And this is something that really affects people's quality of life. I know plenty of kids that have gone to school, they've been made fun of, they've been bullied, and everyone thought they had bad anxiety because they'd be dripping in sweat. And what it is just an overactive nervous system that actually regulates perspiration. And so we have minimally invasive options to really address that. Patients often go see their primary care doc and have options that aren't really durable, but surgical treatment is very durable. We've done hundreds of patients and really changed their quality of life. It's something that if you know someone out there that suffers through this, it really affects them. It really affects them personally. It affects their ability to work, to get jobs, to be in school, and to have a life. And so it's something that we take a lot of pride in evaluation.
If we could go back and talk a little bit more about cancer treatment and screening during the COVID-19 pandemic. What has been your personal experience that has occurred as a result of the pandemic?
Right. So the interesting thing, again, is that early detection of cancer reduces the chance of dying from cancer for sure. And so the most important screening tests that we have worldwide are mammograms for breast cancer, colonoscopy for colon cancer, pap smears for cervical cancer, and CAT scans for lung cancer. And so when we talk about some of the changes we've seen where cancer-related mortality has dropped since 1991 to 2017 by almost 30%, it's largely because of screening. Screening in the United States, it's made a tremendous difference in breast cancer and the opportunity to be cured if you're diagnosed. We know in lung cancer, in this part of the country, lung cancer screening, we're detecting about 3% of patients who come in for routine screening have lung cancer. It's much higher than the national average, which is about 1.5%. And so COVID came in, and what hospital systems had to do is really they had to stop what they felt were elective procedures. The government mandated it and said, we have to put all our resources into addressing COVID and reducing the risk of it being transferred among patients and among staff. So that really happened in March of last year. And so what we've seen is that in 2020, the number of cancer cases in the United States has gone down. And we think it's because we haven't been screening for it. And the consequence of not screening is that you're going to not find things early, and then they're going to present later. So the concern is that these people are going to now present with advanced disease when they could have been treated earlier. So the American Cancer Society today is coming out saying, you know what? You got to get back into screening. And what Excela is saying is we can do it safely. We're open for business. We take all the necessary precautions. We use PPE. We clean between patients. We practice social distancing. And we have to get back to mammograms. We have to get back to lung cancer screening. We have to get back to colonoscopies. We have to make sure we're seeing our PCPs and being evaluated, and see our gynecologists for cervical cancer and our urologists for prostate evaluation. So very important to continue.
So the numbers are lower, but that probably is a false sense of security because there just hasn't been as much screening done.
Absolutely. And the other problem is some screening tests, as you know, come with a copayment. Even if you have insurance, a lot of people through this pandemic have lost their jobs, and they simply can't afford to get a screening test or pay the copay. And that's a challenge. And I think nationally we have to really take care of those patients. We have to give them the opportunity to get screened, especially going through these extremely hard times.
If we could talk about some of the other surgical programs that are done at Excela, for instance, heart surgery expansion.
I've worked at Excela now since 2014. I think it's a great health system, and I think what Excela has really done in the last couple of years is look to really enhance the opportunity for patients to be taken care of by specialists. And right now we have a great group of cardiologists. We're building the program. We have 3 heart surgeons doing very sophisticated work, starting the latest in percutaneous heart valve surgery, doing a lot of less invasive procedures. I've been around heart surgery my whole career, and these are just some of the most outstanding individuals I've ever seen. Excela also is really good in bariatric surgery. Obesity is a big problem. There's a lot of data now linking obesity to cancer development, especially in the young. And 40% of our society is obese. And so encourage patients to think about that, think about their lifestyle modification, think about exercise and diet, and in some patients think about bariatric options. We have 3 great surgeons at Excela who run a comprehensive bariatric program. But Excela has great programs in vascular surgery, general surgery, orthopedic surgery, and really gives patients locally the opportunity to get expert care. And it's here right now, and we follow our outcomes carefully. We really provide a lot of personal attention. And whether you're at Frick or you're at Latrobe Hospital or you're at Westmoreland or one of our satellites, I think you're going to get outstanding care and have a wonderful experience.
I know something else that I guess kind of comes along to you surgeons is the hernia procedures.
Yeah. So a lot of people have hernias, and so hernia surgery used to be all open surgery. If you had a hernia, people would think, oh, gee, how much pain am I going to be in after surgery? And like other things we've talked about today, hernia surgery can be done minimally invasively. It can be done with a robot. And the difference with robotic hernia surgery is that the pain afterwards is dramatically reduced and the recovery is enhanced. And so we have a number of great surgeons who are comfortable with all the techniques and technology in hernia surgery. We're thinking strongly about starting a hernia institute here because we have people that are really good and want to offer it to the population.
Well, we're coming up near the end of the program here. Is there anything I haven't asked you about that you'd like to make sure you tell people?
I thank you for the opportunity, Barry. It's been wonderful to speak with you today. The most important message for everyone today is resume cancer screening. If you have risk factors for lung cancer between the ages of 55 and 77 and have smoked or a current smoker, please contact us. We have a really wonderful program. We need to have you screened. if you were in the screening program but stopped in 2020, please contact us so we can get you back in to keep on following your CAT scan. And for women, please go get a mammogram. It's safe. We practice all the necessary protocols. The equipment is cleaned between patients. Social distancing is taken into consideration. PPE is used. And for patients who do not want to walk into the doctor's office out of fear, we're using telemedicine. And, we'd encourage you to look at that pathway to communicate. We'll do it any way we can. We are concerned that if we don't get back to screening, cancer rates are going to go up again. They've been coming down. I shared some of that data with you earlier. And so for all those disease processes, we've made so many inroads. Please come in. And I think you'll find that if you ever need surgery, we've really done a lot of work in trying to make it easier for you and make the recovery much better and try to take care of you.
And by telemedicine, you mean where your general practitioner or your doctor will conduct that appointment over the phone or by a Facebook or some procedure like that?
Exactly. Yeah, we have multiple options. I'm in the office seeing patients today, and some have come in, and we've seen them in face-to-face. Some we've done by telephone, and some we've done by a video conference, which is web-based, WebEx call of some sort. So we have all three options, and and they all work well. And I actually think that they've been good for the providers. They've been good for patients and their families. And it's nice not to have to leave home, and you can get on a WebEx through an iPad or some other device and communicate. And I think it's been a very positive experience for a lot of patients. We'll operate on people, and we have to talk about biopsy reports. And it's not something you really want to do over the telephone, but it's nice to do face to face. And this gives us the opportunity to do it face to face, and people can still be in the comfort of their home.
Okay, Doctor, thank you. Our guest today has been Dr. Michael's work. He is the medical director of thoracic surgery, as well as the medical director of robotics for Excela, and the director of the Advanced Lung Center at Excela. Doctor, thank you for being with us.
Barry, thank you very much for having me.